When it comes to COVID-19, there has been much speculation in regards to the risk of transmitting the virus in kids versus in adults. Reporter Faith Abube tells us when spreading COVID, there is no difference between age groups.
At the height of the COVID pandemic, debates about returning to in-person school and in-person work revolved around the potential risk of COVID transmission in kids versus adults. And now findings from a study published in Pediatrics show that kids are in fact just as likely to transmit and catch COVID as adults. Researchers looked at data from households in Tennessee and Wisconsin from 2020 to 2021 and found that risk of spread from one family member to another was similar between adults and kids. However, one difference was noticeable when looking at the primary COVID case in the house. It seems that the highest risk of transmission was when the primary COVID case was in an individual older than 65 or between the ages of 5 and 11. And the lowest risk of transmission was when the primary COVID case was in someone between 12 and 17 years old. This could be for a variety of reasons that need to be explored in further studies. Of note, the authors of the study did clarify that results may be different if looking at a more diverse population or more crowded households. It is evident that more research is needed in this area, especially as the study predated the Delta and Omicron variants that more recently affected the U.S. With this Medical Minute, I'm Faith Abube.